Radio Nasha.
Hi, मैं हूँ रंगीली रुचि on Radio Nasha and we are back with one of the most loved segments on our channel which is Ask Me Anything with Dr. Munjaal. डॉक्टर मुंजाल जिन्हें एक इंट्रोडक्शन का जरूरत अब नहीं है हमारे शो पर हमारे चैनल पर स्पेशली बिकॉज यू हैव बीन अ co-host on my show for now the past few months.
Not a co-host, but a very, very happy guest.
Oh, I'm so happy. I'm happier about that. But of course, Dr. Munjaal is a senior gynecologist, obstetrician, but along with that, he's also the director of Namaha Healthcare. So welcome back to the show and your own segment, Ask Me Anything.
Always happy to be here, Ji.
Now I think it is time कि मैं आपसे वो सवाल पूछूं जो कि पिछले कुछ दिनों में हमारे listeners ने भेजे हैं. So are you ready for it? Because it can be anything.
Ready?
Because it's Ask Me Anything.
Yep.
No, but the first question is actually health related. Reproductive health नहीं, but general health related. यहाँ पर हमें मीना ने पूछा है कि weight loss medicines trend में आ गई हैं and over the counter मिलती है, Instagram पर बेची जा रही हैं, gut health capsules के नाम पर. What do you have to say about these?
I have a problem with gut health capsules being marketed as weight loss medicine. Gut health is always a good thing. So suppose आपका diet ठीक नहीं है, you do tend to have gastric disturbances often, and say your gastroenterologist or your family physician has suggested that you take certain probiotics, either over the counter, either over Instagram, either over something else, it's fine. It's not a big deal. However, everything should be taken with a little bit of caution. अगर आप सोच रहे हो कि gut health capsules लेके आप you are just going to become 10 kilos lighter, it's not going to happen.
Okay.
I mean, then the whole world would be on it, and instead of say Munjaro or Wegovy or Ozempic, etc., this would have been the weight loss drug of choice. It isn't.
Okay. So, but great for gut health.
I mean, probiotics are always good for gut health. Do you have to buy an expensive set of capsules or a regimen from social media websites to get good gut health? The answer is no. Good salads, fruits, veggies, yogurt, curd, etc. are great sources of probiotics anyway. So if you have a balanced diet, if you're eating well, if you haven't been on antibiotics for a long period of time, etc., etc., अगर आपको कोई problem नहीं है, I would say don't mess with the system.
Okay, now the next question, ये burning topic है, middle age में आकर के for women now in this day and age. Megha says perimenopause की age बोल रहे हैं कि जल्दी हो गई है and it can start any time now after 38, 39. Is that true?
I mean, it has always been like that.
Okay.
The range for menopause is wide.
Okay.
It can be anywhere, say 44 से लेके 52. For some communities, for some people जिनके parents को जिनके mothers को जल्दी menopause आया, etc., etc., उनको भी जल्दी menopause आने का chance है.
ठीक.
Which is not a good thing, it's not a bad thing, as long as the symptoms are not too bad. अगर बहुत ही ज़्यादा तकलीफ हो रही है, periods बहुत ही ज़्यादा irregular हो गए, heavy हो गए, you're starting to get a little bit of hot flushes, you're starting to see skin dryness, hair issues, or even if you start to see your energy levels dip ho rahe hain, during intimate times, if you feel that you are not getting the same drive or there's a certain amount of dryness which has crept in, meet your doctor.
All right.
They will do a certain bunch of tests. They will see how close you are to that age group. अगर कुछ add करने की ज़रूरत है कि नहीं, it may not necessarily be hormones or hormone replacement therapy, though I'm saying it like that because people are scared of these words. So it doesn't necessarily have to be that. Just sometimes reassurance, little bit of help here or there, suggestion of certain hypoallergenic lubricants, etc. to use can really make your life much more peaceful.
Okay. Now, Ritika ने बहुत सही सवाल पूछा है. This is also something जो I think every second woman wants to know now कि sanitary pads के जगह menstrual cup use करना safe है क्या and should we all make this transition?
100% safe. Menstrual cups do not pose any risk. कोई risk नहीं है infection का या complication का, nothing. It is an absolutely safe way for menstrual hygiene. It is an environmentally friendly and a quite economical way to ensure good menstrual hygiene. However, मेरा भी खुद का एक नियम है that since I don't have a uterus or a vagina, I will not tell a woman कि आपको use करना चाहिए. In the whole thing of saving the environment, saving everything, I understand it. If you can do it, do it. But sometimes it's hard to know कि convenience factor कैसा रहता है. उनके काम पे जाते हैं, do they have a proper washroom where they can say remove it, wash it, reinsert it?
Yeah.
When you are, suppose somebody has a lot of traveling to do, aircraft में कर पाएंगे कि नहीं? So many things people will judge you for using a tampon or judge you for using a pad, saying no, this is not in my. If you can shift to a more sustainable way, why not? If you can't, no judgment, ठीक है, but you understand that कोई complication नहीं होता इससे.
ठीक है.
Second thing, for slightly younger demographic, says people also ask, I'm not even sexually active. मैं कैसे menstrual cup use करूँ?
Yeah.
You can even use it if you're not, like how you can use tampons when you're not sexually active.
Okay.
However, it is just more difficult. Menstrual cup का एक learning curve जैसा होता है, जहाँ पहले 2-3 बार you have to understand like how do I place it, how do I remove it. Some people are very comfortable doing it. Some people are not at all comfortable doing it.
Yeah.
So you try it out a couple. नहीं हो पा रहा है, you are not a bad person. You are not a bad human being. You are not a bad citizen of the planet.
Yeah.
You've tried it. Your intentions are good. If it works for you, great. You found a way to kind of make life easier for you and everybody else. If not, तो भी कोई दिक्कत नहीं. But the thing is, fear of infection or fear of some complication because of it should not be the deterrent to using it.
Okay, the next question is from Shreya. और वो कह रही है उन्हें बार बार yeast infection हो जाते हैं. इसके पीछे क्या खाना पीना या lifestyle वो हो सकता है responsible?
There's this thing we do with our patients who come with recurrent yeast infections, recurrent discharges, recurrent, say, itchiness, etc., etc. The first thing I ask them is, are you cleaning properly? And they're like, yeah. Doc, I'm very hygienic. I said, are you sure? Very hygienic. I said, every time you pee, also, I spray properly and clean it. And then I wipe it. And in the shower, proper soap. I use this product. I won't say the product, but this specially designed for this.
Yeah, pH balanced.
So I think the first thing you do is throw all of that in the trash.
Yeah.
That's one. And number two, you are the cause of your recurrence.
Acha.
What most people need to understand is that the vagina is a self-cleaning organ. You are not supposed to clean it yourself.
Yeah.
All of that area is covered in special secretions and oils which protects that delicate skin. It is covered in certain bacteria which is present in our mouth and the skin everywhere, which is, those bacteria are our friends. They protect the overgrowth of fungus and yeast etc. which cause the infection. So sometimes क्या होता है, एक बार कोई long flight के बाद, या say if you've gone somewhere out, so if you use the public washroom, they get so scared that I'll get an infection from there that they go home and they, मतलब laundry चालू हो जाती है for the next few days. It is not the public washroom that gave you, or the office bathroom, or the airport bathroom, or the movie theater bathroom that gave you the infection. It is you. You washed off all the oils and the bacteria and everything, and that allowed the fungus to grow.
Yeah.
So the first lifestyle change you have to do is to leave your private parts alone. Whatever little bit of water, soap, and whatever goes naturally during the shower, that's fair enough. But खुद करके घिस के साफ करके, you're like making it shine like it's some new car out for delivery, is not to be done. And regarding diet, good probiotics will help repopulate that area with good bacteria and prevents fungal infection.
Perfect. गायत्री पूछ रही है कॉपर टी या आईयूडी यूज करने से लॉन्ग टर्म साइड इफेक्ट्स हो सकते हैं क्या?
No. Intrauterine devices are one of the safest ways for contraception.
अच्छा.
Yeah. So again, there's this whole misconception कि भाई कुछ अंदर रखा है मतलब कुछ infect होगा. No. If it has been placed in a professional way,
Of course.
if adequate asepsis has been maintained, if adequate cleanliness, hygiene, etc., sterility has been maintained while doing the actual process, you should have no problems.
But there's no unprofessional or like non-medical way of doing this, na? You can't do it by yourself,
You
right?
can't do it by yourself.
Yeah.
You can't do it by yourself. But yes, when you go somewhere, even a patient can make out कि clean है कि नहीं है, things like that.
Yeah,
but I'm telling you, very often people think नहीं, government में नहीं करना. everybody maintains good precautions. Everybody maintains good. Sometimes थोड़ा bad luck कहीं कभी हो जाता है. You yourself have an infection, तब डाल दिया, बढ़ गया infection. So those are very, very rare. But an IUD is absolutely safe method of contraception.
Okay. So Hani says hormonal imbalance, anxiety और depression को और ज़्यादा बढ़ा सकता है क्या?
It's like a seesaw thing.
Yeah.
Both play against each other.
Because if I connect hormonal imbalance to what we feel PMS के time पर, yes, it does make you feel so irritated at times on people randomly.
So very often people will sometimes use depression and premenstrual dips or lows interchangeably, which is not correct.
Okay.
Depression is a proper psychiatric diagnosis where you are clinically depressed.
Correct.
And yes, if certain reproductive hormones do tend to exacerbate the symptoms and sometimes make you feel much worse. But to say that do hormone fluctuations, will it cause you to have a little bit of anxiety or low? Yes, I mean, before your period, this is the reason why you feel a little weepy or ragey, because your brain responds very, very sensitively to these fluctuating hormones. So this is more of a generalization, but yes, it could theoretically affect your anxiety and this. So इतना ही बुरा है तो talk to your doctor on how it doesn't necessarily mean कि कुछ correct करना है, but sometimes he can give you certain tips, tricks and how to deal with it in the last 10 odd days of your period. What you can eat, what you can't eat or shouldn't eat, how you can manage it, certain exercises, emotional exercises to make sure that you realize you're unraveling. The train is leaving the station. Don't let it, like churchgate se nikal rahi hai to virar mat pahunchne do. Like how to rein it in much earlier before you say something, because you will eventually feel bad about saying, overreacting to say your kid or to even to your domestic help or to your mother or to your spouse or whoever. So people generally want to be better, do better. So doctors can help you do that.
एक बात बताइए मुझे, जब आप मेडिकल प्रोफेशन में आने की ट्रेनिंग ले रहे थे एंड यू हैड डिसाइडेड कि दिस इज गोइंग टू बी योर स्ट्रीम, उसके बाद में काउंसलिंग भी सिखाई जाती है क्या? बिकॉज़ इट इज सच अ बिग पार्ट ऑफ योर लाइफ, योर करियर.
No, we weren't taught exclusively counseling about things like this. I'll be very honest. There is a serious deficiency in our, at least when, I don't know the current situation, but when we were studying, we were just swamped with work.
अच्छा.
I have done my masters from like a government college, because they're the hardest to get in because there's a lot of work there. Most people want to get into either KEM, JJ, NISA and like in Bombay, those kind of places, because काम सबसे ज़्यादा उधर ही है. You get to learn the most. The most complicated, most difficult cases come there.
Okay.
And you get the most amount of exposure there. Yes, after that for your finishing, etc., you go and do your diplomas and this and that and fellowships abroad and work with a mentor. That's fine. But जो core skill set जो बनता है वो वहीं बनता है. Work ethic जो बनती है वो वहीं बनती है. That ability to take that. So we never had that opportunity only to sit and be empathetic and be kind and to learn how to deal with it. At that time, it was like either you are that personality type or you are not. If you were that personality type, वो आपके practice में भी आ ही जाएगा. If you were not, you have to take that extra care to work with somebody from where you learn.
So important.
It's changing now, I believe, because now with social media, doctors themselves are educating and understanding that these are things I shouldn't be saying. These are things I can't advise. I need to be kinder. I need to be better. So doctors are also putting in the work themselves.
Because there's a reason, जो मैं हमेशा अपने शो पर भी आपके वो सामने तारीफ करने वाली हूँ. But something that I talk about you whenever I'm talking about Namaha or I'm talking about this segment is that it feels just so easy and I can be very me when I'm talking to you, even when हम ये show host कर रहे हैं. But otherwise also half of these problems are something that I would also face as a woman and I can talk to you. But just एक ऐसे भी मैं किसी डॉक्टर से मिली थी जिनको पैर में मुझे कुछ हुआ था and I'd come back from my honeymoon break. So शादी, honeymoon, 6 weeks हो गए थे and I went and I had some tendinitis and he said 6 हफ्ता कुछ नहीं कर सकते, घर पे रहना पड़ेगा. और मैंने कहा मैं नहीं कर सकती ऐसा, मैं 6 हफ्ते की छुट्टी से आई हूँ, I'll have to go to work. And he just like wrote something down and said, your social problems and your medical problems are different. I'm here to solve your medical problems. This is what it is. I was so scared. Also, I could never go back there because I felt like आप मेरी बात समझ नहीं रहे हैं.
So with Namaha, that's what we've also tried to do. We've tried to remove this God complex situation. And we always, from day one, our thing is we don't want any doctor-patient hierarchy. Like, no, at least most of the people at Namaha, I can vouch for that they don't think they're superior to the average patient that's coming in.
Yeah.
I mean, whether you're a chartered accountant or you're a radio jockey or you're a businessman or whatever you are contributing to society in your own way. You have your own set of skills, which we can't. So that's the point of thing, that this is not like मैं जैसा बोलूँ ऐसा करना पड़ेगा. That rest is up to you. We try to fight that, but it's going to take time. But I am very, very, very hopeful for the next generation of doctors coming in. I hope that there are more mentors. Like I have learned from my mentor, and he's very, very kind to his patients. He's very soft. He gets emotionally attached to them, and like even if he's at home and he's disconnected and we're having dinner together, I'll tell him, what's on your mind? He's like, no, this, I hope this works out for her. So it's like, it's not like once that patient has left the cabin, the patient has left his thought process. He is genuinely hoping that things work out for them, and that's what you need. And when you see that, like, no, I mean, that's a good trait to have. I don't want to always disconnect and say, okay, this is that 15 minutes na gaya, abhi life is this, koi jiya, koi mara. Sometimes you need to be able to separate your work and personal life, but for the real, if you see the really, really good doctors, like the top of the top, they genuinely want you to get better.
Yeah,
They genuinely want that you don't come back with a problem. Like, you genuinely don't need me only.
Yeah.
That separates the good from the great.
Yeah. So that is why I think we are here at Namaha, by the way. So
No, I'm not.
No,
This is
I
not
would
a
like
this thing of
to.
Namaha. But I'm just talking. Take any hospital in
Yeah.
Bombay and think of the topmost of the topmost. You'll see their patients always saying, "No, he'll remember me 30 years later also, and he'll remember what was your favorite movie, or what you like to eat, or what, because it's important for him to make you feel comfortable."
Absolutely. But still, I'm still going to plug in and say that I'm going to put some numbers down here in the description. So, अगर आप भी वो चाहते हैं, that relationship between a patient and a doctor, जहाँ पे आप जो चाहे वो पूछ सकते हैं, बता सकते हैं, then you must actually call on those numbers and you can get the help that you need. Moving on. Next question जो है वो मेरा है, मुझे लगता है. क्या weight training सबको करना जरूरी है, or is it just the new fad?
No. It's not the new fad. I am a fierce proponent of doing some amount of strength training.
Okay.
At all age groups. So once you are in your 20s, the amount of strength training you can do is slightly different. Once you're in your 30s, it's slightly different. So you keep modifying it. And I am somebody who literally struggles to push his own mom to say that, no, I need you to do certain amount of strength training as you go older, because strength training has been shown not only to be very, very effective in keeping all your metabolic health good, it is shown to even benefit mental health in a great way. It really, like, there are studies being done now which shows how it helps prevent your cognitive decline. Like, it prevents dementia, Alzheimer's, everything is linked a little bit to strength training. People don't understand that there are plenty of connections between your muscular self, your core muscles, and your brain, and the kind of stimulation it needs. Second thing it does is, especially for women who will be in the perimenopausal, menopausal age group, it makes your bones stronger. People think कि नहीं, खाली calcium ले लिया तो automatically bone में deposit हो जाएगा. Calcium, vitamin, they don't work like that. Like, you'll take calcium, you'll poop it out. The reason why calcium will get deposited is when the bone is under some amount of strain. So when you are walking, when you are running, when you are lifting a weight, when you are straining your muscles and your bone, that's when it actually gets stronger. So this is what people don't. And prevention of muscle loss is very, very important later in your life. So some amount of strength training is 100% required by everybody. It doesn't have to be fancy in a gym. Buy a couple of dumbbells at home and do it.
मेहनत करनी पड़ेगी अब हमें. But thank you so much for telling us that. I think हम सब लोग थोड़ा सा बच रहे थे. नहीं, मैं walk के लिए जा रही हूँ, cardio कर रही हूँ.
So a lot of people also think strength training means, no, I'll have to do deadlifts and I'll have to do bench press and then I'll have to do all the extreme Instagram algorithm where you see these people just like,
Bulking up.
No. That doesn't have to be that. It could be lightest of lightest dumbbells. Do light weights, more reps. But do something to keep your muscle tone and everything strong.
Torture करना जरूरी नहीं है ना खुद को.
I mean, that is,
अगले दिन
if
चले
your
नहीं
body
बन रहा है.
pain is your body's way of saying this is not working for me.
Yeah.
Pain is a response to say कि नहीं, like this is my limit, and you have to stop. And you don't want to be in some competition showing off some muscles that don't exist, only ऐसे pop up हो गए हैं. You just want to be healthy. So for the sake of being healthy, is strength training advisable? I 100% recommend it.
Sangeeta says periods के time पर swimming या sports, how safe is it? या avoid करना चाहिए?
नहीं, avoid नहीं करना. You can swim, and you can swim, play any sports. You can do whatever you want. The periods are not a reason to stop your regular life, unless you have very, very painful periods or you bleed a lot for it to become uncomfortable on the field, or say you're playing basketball or you're playing tennis, and then you're going to get like chakkar aake gir vir na chao, like you're bleeding very heavily, then get that sorted first. But see, you're just having normal periods.
But if you are having cramps, तो उससे आपको कोई और तरह की injury होने के chances बढ़ नहीं जाएंगे?
नहीं, if the cramps are like no, the cramps are like manageable. I'm assuming nobody wants to go play a game of tennis if they are in crippling pain.
Right.
If you are in crippling pain, go to your doctor for the pain and first say, भाई क्यों हो रहा है इतना? या कुछ दो मुझे to manage it. Make me pain free. But if you are thinking that no, I can go and play tennis, I feel like going, the fact is you should. Nothing is going to happen.
Intermittent fasting सबके लिए safe होता है या कुछ लोगों को avoid करना चाहिए? रिया का question है ये. And let me give you a little history with this. I started putting on weight with intermittent fasting, because apparently my body thought कि ये तो starve कर रही है, चलो बचाओ. So I started storing fat in my body.
So I love intermittent fasting.
Yeah? Suits you.
Because for me, the idea is, I live with 4 kids at home. My nephew, niece also live with me. There's always junk around.
Oh.
So for me, cutting down that one chunk of calories probably at dinner or post dinner when everybody is having dessert is very, very important for me. And when I go back home after a tired day, I'll eat quickly, but I won't realize how much I'll eat. And before food is served also, I'll eat a little bit of junk. So for me, that was the key. However, it's hard to say that everybody should do it because a lot of people have other health concerns also. People with diabetes, people with, who are taking some other medications at night, etc. It may not apply to them. So before you start intermittent fasting, if you're not from the profession and not well versed in how it works, speak to your doctor about it and say, no, you are not a candidate. I need you to eat every 2 hours, small healthy meals. I need you to eat then follow that.
Yeah.
But for me, it worked because with intermittent people just think, bhai, itna time nahi they don't realize that the 8-hour eating window cannot also be a binging window. So if you are not eating for 16 hours and you are eating for that 8 hours, you can't be like, I have fasted for 16 hours. I am going to start my day with ice cream. Or I'm going to eat because again after 5 o'clock I can't eat. So might as well have the pizza. No, that you're defeating the purpose. Because ultimately in the grand scheme of things, ho hi gaya.
Yeah.
So that way.
It's always so good to be here and ask you all these questions जो आधे मेरे होते हैं and बहुत सारे हमारे listeners के पूछे हुए होते हैं. I love being here. हर बार मैं कुछ नया सीख करके वापस जाती हूँ और लोगों को सिखाती हूँ. जैसा आप बोल रहे थे, आधी डॉक्टर तो मैं भी बन जाऊंगी. And I'm so happy.
Next 2-3 sessions and I'm out, I think. Ask Me Anything with Dr. Ruchi is going to launching their new segment. Ask Me Anything with Dr. Ruchi is going to launch very soon.
But I'm forever grateful for this time जो आप हमें देते हैं.
I'm happy to be here.
Yeah.
As always, happy to answer all the huge list of questions.
Yeah, there were lots of them today.
No, I enjoyed it.
मेरे और मेरे listeners की भी तरफ से अब मैं दिल से आपको thank you बोलना चाहती हूँ for all the help and for your advice, your medical help and everything else जो आप हमें help करते हैं in life. Thank you so much.
Most welcome. Thank you for having me.
Radio Nasha.